another question happens, ethical question that comes up, that you have been dealing with an abusive patient. Okay. The patient, you see all types of patients, right? You have family members who are aggressive, abusive, forgetful perhaps, or forgetful on purpose, and histrionic, emotional. How will you deal with a situation where the patient is very aggressive and rude, and you've had previous encounters with the patient has acted in a rude, verbally abusive manner? How will you deal with the patient? Any idea? Any
I think first we should go ahead and talk to the patient to diffuse the situation verbally. If that is unsuccessful, that attempt is unsuccessful, then we can probably bring in the security or any other person and let them stand nearby.
Exactly. So yeah, so different. Yeah, definitely. If they're only verbally abusive, right? Or they're histrionic, emotional, or physical. So if they're histrionic, very emotional, you would have a chaperone. If they're verbally abusive or physically aggressive, you would have security. Okay. So you probably have, all of you have experiences where patients are, it does happen more with emotionally with female patients, that you may be afraid that, okay, they may make something up. They may make a complaint that you did not do, that you touched them on improperly or something similar, which you definitely did not do. So whenever somebody is emotionally unstable, you have the patient's nurse at the bedside as well. If they're physically or verbally abusive, then you get out. Your safety is important. Call in security. That's it. All right.
One question, Dr. Umar. If they say the patient is upset and abusive, and how you gonna tackle this situation? So what's gonna be my answer?
The patient is upset and abusive.
Yeah, like upset. He's upset and rude to you. And how are you going to tackle this situation?
So, okay, you will always say that demanding patient, right? So yeah, definitely happens that there's, in the hospital, people are in significant distress and they have multiple things going on, and they may not be fully appreciating what is being communicated, and there may also be a communication gap from the clinician side. And you have to understand that patients are going through a lot, and we are there to serve them. If there's an issue with the patient, it definitely could be that the patient is not fully able to grasp the situation. However, it could be a deficiency from our standpoint or my side, that I was unable to communicate with the patient in a much more approachable manner, in a more layman language. So I would definitely ask the patient that, hey, I understand your concern and I understand that you are frustrated. May I know how I can help you out and how I can address your frustration? Is there anything in particular you're concerned with that I can address to you right now? Okay. So you would try to communicate with them and talk to them, be nice and cordial without raising your voice at all times, and see if you can address their situation if they bring up a concern. If they bring up a concern, I will amicably look to address it in layman terms and try to come to where they are, try to come to an understanding of what they're able to understand and comprehend, and I will look to try to talk at their level. So this is only if somebody is just being upset, histrionic, emotional, not, hey, I don't understand anything. What's going on with me? I don't know anything. Right? That's one. But they're abusive, hey, shut the F up or get out of here. That's a different story. Then you call security. Then you just call security. So yeah. Yeah. So yeah, that's it.
I have two questions, Dr. Umar.